ESG initiative. Let's give a round of applause to our panel. Professor Dr. Tan Maw Pin from Act for Health, Mr. Chin Tiong from TribeApp, and Ms. Lim Guat Yen from UTAR. And last but not least, moderating this panel discussion is Dr. Carol Yip from Managedcare, Sdn Bhd. One more last round of applause. Now, a kind reminder to our fellow participants and listeners for today, please do remember to off your phone or put them in silent mode, just to make sure that we do not disrupt our panel discussion. Also, if you are taking a picture or a video, please don't forget to hashtag WCC 2024 and hashtag Invest in Women. So, Dr. Carol, the floor is yours.
Thank you everyone, and of course to Talent Corp, the team, Natasha, Puan Mahuran, and everyone here in this room. So now, though it's a small crowd, but I'm sure today our discussion is going to be very, it's going to apply to every one of us, right? Because we're talking about community-based care ecosystem and ESG principles. Basically, actually this is actually a follow-through from this week, actually on Tuesday. YB Stephen Sim actually launched the event for Women's Week. During the event, I did a presentation to YB talking about how can we create career opportunities in Malaysia aged care industry. So today is a next step forward where I have two of my esteemed panelists, whom I know many years, long time. So let me introduce them, and I would like to ask each of them to introduce themselves briefly. Of course, start with Dr. Tan Maw Pin. Yep.
Hi, thanks for the opportunity. And I'm sure you're just the right people to be in this room. And I am actually a professor of geriatric medicine. So, and I am based at the University of Malaya. That's my day job. But as a hobby, I work with Carol to actually see how we can actually develop a care ecosystem for Malaysia. But in actual fact, I have a problem with the definition of care ecosystem, because actually it's not because of Carol, but it's because we currently think of healthcare and social care as separate. So all the impetus is the development of the healthcare, and the Ministry of Health develops independently from our social care system. So, but this community-based care ecosystem has to actually have both equally represented health and social care. So hopefully you'll be able to actually demonstrate that today.
Yeah, thank you. And of course, Rose among the Tons. CT is his short name. So Mr. Ng?
Thanks, Dr. Carol. Okay, my name is Chin Tiong. I'm from TribeApp Singapore. So TribeApp Singapore, as a company, we deal with aged care. We provide technological solutions and services for senior. So in Singapore in particular, I think in this region, we are seeing growing senior population. So this is why we have been into senior care for more than 10 years now. So we provide a non-intrusive way of monitoring the seniors living alone in particularly. So you can visit our booth later on after this next door to find out what we do. Yeah, that's basically what I do.
Of course, then Yen, from UTAR.
Yeah, hi, I'm Lim Guat Yen. I run the training center at UTAR. My center is called Center for Corporate and Community Development. We provide upskilling and reskilling, not just for UTAR community. A lot of people didn't know that UTAR actually has a training center. We are actually a HRD Corp registered training provider that provide training for all sections of the community, right? Organizations, individuals, elderly, young, graduate students, and all. Okay, that's all from me.
Okay, thank you. So this discussion will take us about 30 minutes, and I have about 15 minutes for Q&A. So really welcome every one of you here to ask our panelists questions that you want to know. What do we mean by community-based care ecosystem? And of course, today, very specific. I'd like to have our discussion very much focused on, if you can see up on the screen, it's actually about our Ekonomi Malaysia Madani Roadmap. It's about championing to improve the quality of life for our rakyat. And so, very clear, as you can see on the screen, is about healthcare, like what Dr. Tan mentioned, all right? So how do we then make better care for our Malaysian? And we will now benchmark based on the 4 pillars, as you can see on the screen, which is actually the healthcare white paper. Mention about transition to community-based care is a very big word. So I believe after hearing from our panelists today, you will be able to understand a bit clearer what do you mean by community-based. Means what? Yeah, it is actually care at your own home and care within your neighborhood, all right, in a very simple way of explaining. And how do we shift from treatment to prevention, which I know this is something that Dr. Tan, has a lot to, explain. And I've been working with her for a while. I know she's a very dynamic doctor, I must say. No nonsense, right? She'll tell you straight on your face, I don't like what you're saying. And that's what we need. We need doctor to really tell us what is good for us and what we must do, all right? Next is sustainable and just healthcare financing means what? We know now healthcare is very expensive, all right? So how do we then implement an ecosystem that we are able to afford it for as long as we can? Now, just now, Dr. Tan mentioned healthcare is not just healthcare, it's about social care. What does that mean? When you're old, you're at home, you need care. So are these people who care for you, are they your family, your maid, or somebody who's trained, properly trained to come and take care of you? And all this needs connection. Imagine in Kuala Lumpur, PJ is so wide. So we need a good system that connects everyone in the community. So that's where I have Chin Tiong here, CT, very well versed in IT and all, will share with us how Singapore, right, some of the examples in Singapore, how the government has done it, all right, to integrate. Of course, now the buzzword is digitization, and not only that, is digitization and digitalization. I'm like quite confused with the pronunciation, but I hope by today, CT will explain to me, what are these 2 buzzwords. So let me just start now with Dr. Tan, all right? One of the things that we always know that medical doctor has roles to play, right, in the hospital. Now that we want to transit from hospital, institutionalized care to the community-based, how can doctors, medical doctors, work with the community and other multidisciplinary professions?
It's a big problem, isn't it? Yeah, so traditionally the healthcare profession is a very arrogant profession. I can say that because I'm a doctor. So, and we work with doctors and other people follow orders. Yep. So, so there needs to be a lot of change go on with the way the healthcare system is developed, not just to make sure for them to even respect someone who provides social care as one of their own, but also for them to respect another healthcare professional as an equal, not as someone who takes orders. So that's the biggest struggle we have. And I was sharing to Carol that actually this is an ideal platform for us to bring bring people who have had lived experience of caring for older adults and children. There can be similarities. We do borrow ideas from each other, though I cringe if everyone tells me that old age is second childhood. I get really mad, so don't say it to me. Yeah? Okay, so then the other thing is that we also need people who have the maturity to stand up to these very arrogant doctors and really have that passion to actually stand up for the rights of the older adults. So I'll give you an example. So when a patient comes into my ward, usually they're seen by a junior doctor, but they just copy us, We, however behave, they just copy. So they will tell the family members, so the person comes in with a fall. Why did you let him fall? What a ridiculous notion. Why would a family member ever let the loved one fall, right? And why is it up to me that whether I let him fall or not? If he decides to get up and then he falls, it's his prerogative. It's his right, it's his autonomy. Then the next thing they say is, okay, your dad is ready to go home. They don't tell dad, sir, you are better now, you want to go home, you are fit to go home, but who lives at home with you, how do you think you can manage? No, they wait for the daughter to come. They always wait for a daughter, not the son. And then they will tell the daughter that, dad is ready to go home, now you take daddy home. Can you smell a disconnect here? Yep. Don't let him out of your sight. Don't let him fall again. That is their limit of social care experience. So who is a doctor? How is a doctor ever going to be able to be even part of this care ecosystem if this is the attitude of our doctors? So we have to train the doctors. Maybe that's my job. But my job is also to bring in people who are going to be patient advocates. So people with lived experience, either people who have been patients themselves or people who have cared for patients who are able to fight their corner as well. And my dream is a multidisciplinary team with no fences. So there's no fence between the community and the hospital. And the doctor is merely the conductor of the orchestra. And even the role of the conductor can be delegated to somebody else who has adequate knowledge of all the interpretational teams. Because actually, if you ask me what my role in the ward is, if my ward is functioning well, I can go out and play. Because somebody else can even be my assistant conductor. I only get busy when my orchestra doesn't know how to play. So that's the kind of paradigm shift that we have to think of in terms of healthcare.
Yeah, I can relate to that, Doctor, because Managedcare, as you know, my team, they're all here. We are also care managers, right? And each time when we get a call from the hospital or even from the family member, they say, please tell me how to take my dad home because the doctor say my dad can go home today, this evening. And guess when is the day? It's either Friday evening or Saturday evening, or Sunday evening.
Usually Friday or Saturday.
It's always during that day. I said, look, if you want me to find someone to come and help you, my staff, it's Friday evening. They have gone home. Saturday, Sunday, we don't work. All right. So we also face that kind of challenges. It's like disconnection. There's really no well planned, all right, communication. And being a care manager is not easy. Because why? We don't just handle the patient, we handle the family. And guess what? The family are the ones that, they have so many opinions, and so many decision makers. And at the end of the day, we want to know who is the paymaster now, right? We only listen to the paymaster if the paymaster knows what to do. So we can go into that a little bit more. But let me just then bring back to the discussion that after all the doctor need an orchestra of people, right? So who are they? From nurses to physiotherapists, from dietitian, right? Even trained carers. So with that, I struggle a lot. I've started Managedcare for 10 years, easily. Until today, we try to hire Malaysians to work. It's so tough, all right? Even Malaysians are happy to work, but they don't go through a proper set of training. They only come because they say, I've taken care of my mom, my dad, so I know now I want to be in this industry. So I'm happy to come and work. So then I start looking for, because I also believe what Dr. Tan says, that sometimes care is natural. It comes from within. But we still need some training, right? Yeah, some techniques, they call it. So then I went on and searched for institutions. So I'm happy to, work together, come up with proper structured training programs, like what other countries they're doing. So come along UTAR, and that's where I met Yen. Again, it's another long journey because explaining to universities that we need education institute to create programs that is recognized, right? Recognized. So would you like to share a bit how then education institutions can play a big part in this? I call it is a care economy, and we need a lot of people. Yeah.
Thank you, Carol. Yeah, as someone from an academic institution, I wholeheartedly recognize the importance of academic studies, yeah, to shape a person's future. However, it is crucial, right, to note, to acknowledge, right, that you have to continue learning continue learning throughout your journey in life, all right, because things are changing so fast today, all right, you can't help, all right, but to have this mindset of continuous learning. If not, you will be left behind because there's always, we are always inundated with new technologies, new ideas, new challenges. Okay, so while an academic education, all right, provide you with a solid knowledge and skills, right, but it only represents the beginning of a lifelong journey of learning and growth, and that's not enough to take you through. Okay, that's where we come in, all right? Okay, so over at our Center for Corporate and Community Development, as I mentioned just now, we are an HRD corporate registered training provider. We have trained 326,000 individuals since 2003. All right, and across diverse areas of soft skills and technical skills. And our participants range from corporate workers, professionals, homemakers, elderly, students, graduates, and so on. All right, I think many of you know HRD Corp, registered training provider. We are affiliated with the Ministry of Human Resources, Kasuma, to drive the development of the existing and the future workforce of Malaysia. Okay, so now as a training center, we at UTAR, CCCD, we are committed to enhancing community care for the aging population. Okay, this is one of our key focus areas. And we have a robust human capital development initiatives to support this, yeah? How do we do that? Okay, number one, we provide specialized courses in partnership with Managedcare, all right, to equip individuals with essential skills and certifications so that they can effectively and properly take care of the elderly and their families with compassion, all right, within the comforts of their homes or within the community. All right, in so doing, we aim to develop a skilled workforce in Malaysia, all right, to address the evolving needs of the aging population and to provide them with superior quality care and support, okay? And at the same time, we also aim to facilitate the re-entry of women back into the workforce, all right, and also retirees looking for employment. And in so doing, we aim to promote diversity and inclusivity in this rewarding field of aged care sector, okay? And ultimately, we aim to empower individuals with the requisite knowledge and competencies to address, again, the evolving needs of the Malaysian aging demographic, okay? And, well, which is in line with the, I must say this, yeah, which is in line with the Ekonomi MADANI Malaysia roadmap, which aims to realize a vibrant and sustainable community-based care ecosystem. And together, I believe we can build a future which embraces aging with dignity, compassion, and respect. Thank you.
Okay, let me just add on a bit what Yen has said. All right, we have done this also with our own, before we go to the university, definitely they'll ask me, hey Carol, so have you done any training before, right? Do you know what's the market perception like? You know, so I have to prove a case. So what we've done is, throughout for the last couple of years, we actually run mini workshops, like a day workshop where we teach you basic stuff like, you know, how do you change diapers, adult diapers, how you transfer an elderly from the bed to the wheelchair, right? Then we have the physiotherapists who will teach them, you know, how not to hurt your back when you lift up an adult and things like that. And interestingly enough, a lot of them say, oh, I didn't know there is such techniques that I need to learn. Yeah. I still remember it was one time we have this Petronas sent some executive, you know, their staff, and they came, And the guys get to experience how to change adult diapers, and then they get to teach how to feed an elderly who's bedridden. And they were so like, you know how to say, they suddenly realized that actually taking care of an elderly, actually, we really need a lot of patience, right? Yeah, not just patience, it's about your compassion, right? So from there, I told myself and my team, I said, let's work harder now to work with universities. And UTAR, one of the, and you know UTAR set up, right? They have very comprehensive. They have School of Medicine, they have counseling, School of Counseling, right? You call it psychology, right?
Yeah, counseling and psychology.
So with all this, I think the university are able to piece up a whole comprehensive training program. And being adult coming back to training is not easy. I can tell you they have no patience. You ask them to sit through for one whole month or 3 months, they'll say, no, Carol, I don't want to come and join your training program. So it's not easy, to be honest. It's very, very hard. We have to please the student, entice them to come on board, right, get trained. Next thing you say, okay, now that I'm trained, I need to go and work. And when we have a case, like what you heard from Dr. Tan Maw Pin, when a case comes to us from the hospital, it's not easy. Yeah.
It can be so prevented, but maybe we can talk about it later.
Yeah, we
it
can
can
do that.
so be prevented.
Yeah, it can be prevented, right?
Yeah,
so
yeah, yeah.
we'll talk about that after.
Yeah.
So when the case come, then they say, you mean I have to stay in the family house 24 hours, 1 whole month? No, I don't want. I don't want to do this kind of job. This is the reality. All right? So, never mind. I said, we will persist. So how to entice people to come into this? Also, we need to have very good information, right? Communication. And manually, I can tell you, information will just get lost along the way, especially medical terms, you know. So we need to have a good, robust system. And there comes CT. I've been pursuing for a while, right, CT? To get you to come back to Malaysia.
That sounds dodgy.
Yeah. He left Malaysia, okay, then never want to come back.
I was born in Malaysia.
Yeah, born in
I'm
Malaysia.
Malaysian, actually.
I said, please come back to Malaysia because with your
I'm back
experience
here
in IT and what you have seen how Singapore government is doing all this good work, please come back and help us to implement something. Okay, come. Share with us.
Okay, firstly, I think we talk about digitization and digitalization. Okay, that's based on my perspective. You don't, for the real definition, I think it's easy to Google. From my perspective, digitization basically just convert the analog data, pen and paper into digital form.
Can you explain that in English?
Well, that is the simplest form I can think. Okay, then why you want to do that? So that we can do a digitalization of it. So we need to digitize the data so we can do the digitalization. So I won't be, before this I've spoken to Dr. Tan, so I say I won't be touching on the medical part, but I'll be touching on the healthcare part. For example, you take a reading from a medical device. That's in analog form, right? So how you digitize it? Through a wireless protocol, you transfer it to the cloud backend, you digitize it. The record is automatically in the database. So then with that, the digitalization come in, right? We can make use of the data collected. We can do a trending. We can do a alerting when, say, like blood pressure is above a certain threshold. I mean, that's a simple form to explain. Does that explain, Dr. Tan?
I'm trying.
Simple enough? That's simple enough, really. So digitize the data. Digitalization will make use of the data. Without digitizing the data, there's no way we can do anything about it because it's still on a piece of paper. I can't make use of the data. Then back to how we relate it to what we do as a commercial entity. I'm probably the only one coming from a commercial entity, so I explain it from a commercial angle. So we provide remote monitoring services for seniors. So monitor the seniors' activities at home. Like in the case of Singapore, there are a lot of them actually staying alone on their own. The children could be overseas, and a lot of them, surprisingly, no children actually. So even if your closest relative, your siblings, if they are already in 70s, 80s, your siblings are in the same age group anyway. So they are also elderly. So how can you get an elderly to look after an elderly? So this is where we provide the remote monitoring services. So we have the sensors installed in their house. So sensors are analog data. You see, you capture it, but without digitizing it, I can't make good use of the data. So once you digitize the sensor data, from the sensor data, then we can actually do some profiling. We can see the behavior, we can see the pattern, we can then do alerting when, say, the person don't move for a prolonged period of time. A person can just pass out or, whatever happened, fallen down or whatever, doesn't move for a period of time. This is where the digitalization will make use of the data collected, send out the alert, inform the caregiver, and then this is how the technology can help. So then how this link it to social economy? I mean, linking back to our topic today, community-based care. So with this, then we provide, from a technology angle, through digitalization, we provide a platform. Then we have service providers like community care providers. We work with community care providers. For those people without family members that stay with them or family members are overseas, they can subscribe to these services provided by the care providers. Then they will be the one doing the monitoring. Say that, for instance, the seniors having difficulty in breathing, quite common. A lot of them have this kind of issue. They can press the emergency button and somebody will respond to them. So this is where through technologies we provide such a community care kind of, community-based kind of care. So, and we know technology is double-edged sword. It is good, and it's good if you make good use of it. It can be used for, as I think we probably read in the news, how they use it for election in India especially. I just read about the news, very interesting. A lot of deepfake videos coming up, even the deaf. The past minister can be alive talking now, giving speeches. Very interesting. So this is where we, as a technology provider, we always look at it from this angle. Technology is good only if we make good use of it. So this is why our focus is a lot in a non-intrusive way of making use of this technology, so that as a tagline, we want to empower the seniors to be able to live alone independently. Not live alone, live independently. I don't think people like to live alone. They like to live independently. So that's from our angle.
Okay, definitely, I mean, share a bit on, again, from managed care perspective, because we have gone down to Singapore and seen how the HDBs, the flats and all, how they're connected through the digitalization of platforms. They also have all the senior citizen, the activity center, the daycare centers and all. So these are the connectors, right? You connect using all this system to connect every touch point other than the hospital. So now, from we as managed care perspective, we need this kind of connection, because why? Because once the patient leave out of the hospital, honestly, if you do not have a system like that, we really don't know what's happening at home. Right? Now, hospital has all the systems, have all the data. And we also have cases, I'm sure my team will tell you, this patient will go to different doctor, different hospitals. We also need a system to be able to consolidate all the information so that my team can do care plan, all right, can know exactly what type of medication they need. So that's what we meant by this kind of platform system, all right. I'm sure during the COVID pandemic, we all know, right, we can't go and see a doctor. Right? What we do is we have a Zoom online teleconsultation. So that's what we are saying. We are moving towards that. So now, come to the next question. I'd like to talk about, Dr. Tan say about what prevention, right? So share with us, what can we do?
So
in terms of
linking on to
prevention?
the digital health thing. So previously, our Malaysian healthcare system is incredibly hospital-centric. And the National Health and the Health White Paper is trying to remove the community-centric thing. But it's 20 years behind, or 30 years, or 40 years, or 50 years behind. Because nowadays, people are actually removing the barrier between health and social care, and they're still just removing the barrier from between community and hospitalization. But being behind this is not always a bad thing, because we get people to learn. We get to learn from other people's mistakes, but also we get to start from where they are now, and we don't have their burden, the legacy problem. So where do we start? We start straight with digital health. We don't have to go through the whole journey of, community care, hospital care. Where is the difference? Which one is looked after by community? Which one is looked after by health, by hospital? And then the other one is healthcare, social care. Since our social care system barely exists, then it's all healthcare, So the whole of healthcare and social care is healthcare. So then, so we think about what monitoring means. So monitoring for someone who is before illness means opportunistic or timed assessments where to allow for early detection of deterioration, whereby to remedy or prevent the onset of illness is there. Right, so so we need kind of timed points where the older person will check in to a digital system, get some tests. Yeah, not the MRI scan, the really expensive blood tests. Yeah, I just got my call from my auntie this morning. My thyroid not right. What do I do? So I said, why did you check your thyroid? Then she went, I went for a routine blood test from my doctor. Now you expect me to answer that question, is it? Of course I don't know what to do because there's nothing wrong with your thyroid. Why you go and check the thyroid? So don't go and simply check things that don't need checking, but really looking at muscle strength, memory, those sort of things, and also if they already take medications, they need some sort of routine check to make sure that they're not suffering from side effects of the medications, those sort of things, so that we can detect problems early, deal with them as soon as possible, and they do not cause any disability. Then hospitalization. So then we can prevent people going to hospital, and even when they potentially need health care, a lot of times they use hospital as a first port of call. So using the digitalization method, you can actually do virtual wards, hospital at home, where the older person who does not need the really high-flying, heavy equipment that actually makes them worse, who are much better off being in their own environment that they're familiar with, more comfortable with, don't have to lie on hard trolleys for hours, get pressure sores, don't have to, they can stay at home and be cared for. So, and then when they get better, they have rehabilitation. And they can have rehabilitation within the home environment where the chance of recovery can be faster. And then even when they need a bit of care, they need caregivers who are trained to enable and to actually know how to restore function rather than take over. Because at the moment, our older adult cannot do something we just do for them. No, it's not like that. Which bit of that task can you not do? So my father-in-law is quite old now, and he's a bit frail. So when we go over to the houses, if there's too many dishes to wash, we have a dishwasher. But has he ever used a dishwasher all his life? No one. So he doesn't quite know how to do a dishwasher. But I don't load the dishwasher for him because he can load a dishwasher better than I can. I always don't do it right anyway. So, but then I'm always there when I hear a little bit, why is he taking so long? Go and check on him. Oh, yeah, Dad, the drawer just gets pushed in. And then I said, you push this button, and then you can close it and start it ready. Then so he did that. He pressed the button, he pushed it, and you can see his face when the dishwasher lit up. Wait, good, he says, good, because he's never activated a dishwasher. And at 91, he activated a dishwasher for the first time in his life. So it is actually something that we can actually facilitate, teach caregivers. I don't like the word caregivers anymore. I like to call them, enablers. Yeah. So to actually continue to enable our older persons to lead a fulfilling, fun, enjoyable life.
You want to say something, Yen? Anything on this? Yeah, about teaching the carers, no longer really classroom teaching, but it's more on like practical things. Yeah. That's why we say our training program has to make it fun. Just like kids, right? They would like to have learning is through having fun. I think it's the same concept. Yeah, what Dr. Tai has shared, right? Even taking care of elderly is again like taking care of a kid. They are, they have their own, so to speak, childish way of behaving. But I also like to say, Dr. Tan, in this care economy we are talking about, a lot of people thinking that when you want to take care of an elderly, you need to be a nurse. So how do we change this mindset? Sometimes taking care of elderly, you don't need a nurse. You need somebody who really know what to do.
It depends what you're doing, right?
Exactly,
Because if
yeah.
they need, if they have a wound, you know, if they have tubes sticking into them, I hate tubes. You know, this
Yeah.
geriatrician, as fast as I can, the tubes need to be taken out. But some people do need the tubes. So if they have nursing care needs, they need a nurse. But what if they have a social care, kind of activities of daily living? You don't need I mean, to be honest, our nurses tell me it's not their job to change diapers. So I've got two problems. Older people don't need diapers. You don't need to be a nurse to change diapers if you end up having diapers. But they don't need diapers anyway. They should be able to go to the toilet. Yeah.
Okay, so there you go. So one last question for my panelists before we open up to the floor. All right. Now, we always think about aged care or elderly care is only it's a community or family, right? But even now, I come across a lot of, especially ladies, they actually leave their job because they have to take care of their aged parents. All right. So, and we know in companies, right, we have all this ESG principle, right? Environment, social, and governance. So I'd like to then ask my panelists here, now, how can company now incorporate in their framework, right? Be it employee benefit or enabling the employee how to take care of the aged parents better, the part of the social care. What do you think? How should the company can start this initiative, right, for their staff? Now they talk about childcare, having a childcare center in the company. If they say it's a multinational company, right? Should we start a daycare then for our parents who can come to work together with the adult children? What do you think?
Well, can I take this up? Yeah, from a training perspective, of course, because I'm we are a training center, right? I noticed that in Malaysia, I think we do have facilities and some incentives for mothers, okay, with children, young children. Maybe they have lactation rooms, maybe childcare service, flexible working hours. Because I visit companies a lot, but not so many of them are focused on have this training courses or awareness for elder care responsibilities. Now, they got to realize there's a lot of sandwich generation nowadays. You know what sandwich generation? That means the generation that has to take care of their kids and they also have to take care of their elderly. All right. So more often than not, companies focus on one side, not the other side. All right, which is also creating a lot of burden and stress for their staff. So I honestly am currently actively trying to enhance and create awareness among companies by introducing a lot of health talks and community or enablers, or as you use it rightly, to create awareness on training on caregiving techniques, on dementia care and all that, so that it will hopefully ease their burden. And with this knowledge, and that will also help encourage the companies to start being aware and come up with some incentives or some facilities for the elder care as well for their staff. Yeah, okay, that's all.
How about Siti?
Okay, being in this industry of elderly care for some time now, as a company, for myself, I do hire seniors. Okay, we do installation, we do setup, simple setup. If you have seen my device, it's simple. Double-sided tape, stick it on the wall. So for my installer, not on average, the youngest being 56 actually, so the oldest like 65. So very often people have that kind of misconception, thinking that I'm not abusing, how to say, not manipulating, what do you call that? Like
Taking advantage.
Take advantage of them, of their age. Yeah, of course they are getting a lower pay because firstly they are on flexi hour, totally flexi hour. As and when need to do installation, if nearby their place, they can take up their job, they do installation, we pay them. And the job is very simple. Often it's just like a 15 minutes work, you are finished, you are done with the work job. And Singapore public transport is very well connected. Everywhere, every part of the country is reachable through public transport. So yeah, I do that even as a company, we do that. So whether that, to me, I see the need why because dealing with elderly for so long, very often I also can kind of like see why we need to give them an opportunity, a comeback, because as they retire, like in Singapore now it's already 64, retirement age. As they retire at 60 plus, they are still very active, they can still do a lot of things. And they still want to do a lot of things, so it will be kind of like wasted if we don't really tap on them. And especially we are dealing with senior. As a senior, I often thought that senior would be able to talk to senior better versus younger children, especially the last generation, not last generation, the current like 70s.
But don't you find they're more reliable as well, these seniors? So you ask them to do a task, it will get done, right?
Actually,
Yeah.
yes, that's my thought. This is why I would say my...
And the word you say is, you want to use is exploitation, right?
Yeah,
Exploit them,
people might think that I'm exploiting them partly because they are on flexi hour, definitely they get a lower pay, correct? But not the case. I mean, especially for this region, the older generation speak in dialects actually. That's the issue with the younger one. I can get a younger one, they can't speak in dialect. That's a problem. In Malaysia, it's the same. I think we can't run away. So that's the language communication is actually a barrier. And especially get into because we do installation, we need to get into the elderly home. So to get into the elderly home is often the challenge because you'll appear as a stranger to them. How to get into them, they have to be comfortable with you. So you can't just get anyone, and especially with scamming issues, Singapore is very serious problem. Even if you want to do good things like deliver food, which a lot of the social agency does, the issue is that even if you deliver food, they'll question you a lot. Is this a scam or what? So we work in Singapore, Red Cross deliver food to the seniors as well. So the volunteer just deliver the food there, and then they call up a police saying that somebody trying to put something into the food and deliver to me, ask me to take up the food. So these are the common issues as we see dealing with seniors. So that's why a lot of these retirees or so-called semi-retirees, I see them, they don't have anything to do, so I ask them whether you want to do this part of the work, which they are more than willing to do it. And one of the installer, or what I call them as installer, they're going around to installation. He just passed 55, but he decided to quit his corporate job to help me on this thing. So he told me, I do installation. For example, you stay in the east side, going to that place. If you take a normal bus ride, it's just like half an hour you can reach the place. Then he says, since I got so much time, I take the longest route because I want to understand, I want to see the scenery in Singapore. So he spent 1.5 hours to take the route. I say, yeah, so if you think that is good for you, it works for you. So basically, it's just like give them a chance to come back, to contribute back to the economy.
So in other words, you're saying hiring retirees is also very good, right? For, not only that the clients see them as trusted people coming to the house, but the retirees also can have a more active, enjoy the work, which is good for mental and emotional. So yeah, why not? I think it's a very good case example.
And I think these retirees have a lot of time. I think the issue with us being in this generation, we don't have time, we lose the patience. So once you don't have time, your patience runs out very quickly. Agree? As a doctor.
My parents complain all the time. Don't you have enough time for me? But I already have given you 1 hour.
So
is that not cukup? 1 hour, a lot of my time, but to them, not enough.
Totally
time.
agree.
So this is why when you get retirees, they have a lot of time. They have, like I say, half an hour you can reach. Why you want to take 1.5 hours? You say yes, all his time. So okay, if that makes you happy.
Come for reskilling at the training center.
So reskilling, upskilling, and come and work in the aged care industry.
We learn, unlearn, and relearn. Okay.
Yeah, it's true actually. In fact, Managedcare has hired a few flexi time, and then they are all matured adults, and I can tell, and they are very productive. To be fair, right? They are very productive. They give you this task, they will get it done. So I think it's win-win all the way. So we have 5 more minutes left. All right. So let's. Audience here, any question that you'd like to ask our panelists? Yeah. Any question?
Or anything to share?
Any sharing? Yeah. Yeah, sure, come. They are giving you a mic. Yeah.
Would you like me to stand?
To you, we are fine. Yes. Your name, please?
Hi, my name is Nadra. Okay, and I have a question that Siti brought up earlier on. It's about how these people who are of old age, they are able to get access to people when they pay or subscribe to these services, right? My question is in regard to accessibility. So what's the cost like? Like, what are we talking when they are subscribing to these services? And also, let's say if it is pricey, if they can't afford it, what are the alternatives that they can now take? That's all. Thank you.
Thank you.
Okay. Okay, as we get into, before I forget to talk about aged care industry, it's actually a very challenging industry to begin with, so but I've been in there for more than 10 years. So price is often the problem, actually. So being a technologist, I like to do a lot of things. My initial devices were really advanced. Then I realized that, yeah, for advanced, the thing is pricey, right? So then the thing didn't work. This is why I spent like 10 years. And then for last 2-3 years, then only I see things picked up. So partly, yes, to educate the seniors, because if we provide them with a technology, they can't use it, it's meaningless. So we need to make the thing simple enough for them to understand. And then we have to make it very, very cost effective, knowing that a lot of these seniors, when they stop working, they definitely stop working, they're already in senior. When they stop working, the first thing they do, I've noticed many seniors, they cut down on all their expenses. So basically, they cut down everything because no more income, they'll cut down everything. So this is why getting into senior aged care, you can see that a lot of the services are already bundled in with that kind of mindset that it can't be too pricey. Unless they are targeting those high income earner, those rich people. There are services that actually offer to these rich people. You can get a 24/7 kind of service, but you pay for the price. So, but we are talking about more in the general community whereby services are a lot more affordable. So then, of course, like it depends on what kind of services you are talking about. And even as of today, there are already many of these providers, like, I don't want to name them, they could be my competitors, but there are a lot of these providers already providing them anyway. So as a consumer yourself, you get the choice anyway to choose which are the one that fits you, which are the one that more affordable to you. So very often, I mean, you can't run away. Affordability comes with a certain balance.
Maybe I'll just add on. Like I say, I know him for many years. When he first came to Malaysia, he came with a system that cost a few thousand ringgit. I actually bought that system because I wanted to try it at home, how to monitor my mom and dad. So then I told Siti, with a few thousand, I can tell you, no, you're not going to sell these devices well. I said, price. So post-pandemic, he came back again and came back with some devices again. And this time, it's only a few hundred ringgit. And he has made it so simple. So I said, yes, Siti, this time, I really want to see how to bring your product in so that we can then sell to Malaysians, right? So you're right. So we have to me, this industry is very interesting. It actually keeps our toes, keep us on our toes all the time. Because money, financing is important. So it keeps us keep thinking, how do we make care affordable, right? So one of that is the devices have to make it affordable, right? All these, and make it easy for the elderly. Next is, I know, some of you are thinking, do you know that recently I paid a few thousand, can be 4,000 to 5,000 just to get a carer to take care of mom at home who's bedridden? It's very expensive. So how do we move this forward? That's the reason why I want to collaborate with Talent Corp, that we want to hire back all the women who are interested into this industry, hire the retirees who are interested in work in this industry. So the more supply of manpower we have, we can then bring the price down. Currently, there's
it's
more
economy of scales.
Yeah. Now there's more demand than supply. And what happened is the supply comes from the foreigners, foreigners who come and work. So to me, it's actually just like economy of scale, it's a typical kind of business. It's a service industry. The more workers we have, the more people want to come and work, then we are able to price it competitively.
And there's more chance of sharing the care as well.
yeah,
Because
exactly.
rarely do people need someone
Yeah.
sitting there every minute.
Yeah, and Malaysians taking care for another Malaysian is so meaningful, right? I mean, again, I think Siti mentioned about dialect. You know, you need Chinese, Malay, Tamil, and all. So I always say, why are we not making this industry become a professionalized industry that all of us are so proud of? After all, Malaysia is one of the best Asian countries to retire. Yeah. So with that, let me just give my panelists, 1 minute to summarize some of your thoughts and to share with our audience. Thank you.
I think we're out of time, but just like to say that the word care can be misconstrued. We should be considering how to enable and maintain independence, and it does not need to be expensive. In fact, good care saves money.
Siti?
As a technology person, I always believe technology can bring down the cost as well.
Yes.
We talk about distributed hospital, we talk about decentralized nursing home. The whole reason is actually to bring down the care prices.
That's right. And Yen?
Yeah, I just want to add one thing. I went to visit his booth, right? The device is really affordable. I think so. It's what, 199 today special. Yeah, for this event. It was only 199. Anyway, back to, seriously, and I was thinking for my mother. Yeah, exactly. Okay, anyway, back to where me giving a very quick summary. Yeah. I totally agree with Dr. Carol. I think we should professionalize the caregiving or enabler industry. And it's so meaningful to have our own people to actually take care of one another and not someone who don't understand each other. So, and I'm very proud to be able to work with Managedcare, frankly, to offer all these specialized courses so that we can train as many people as possible, all right, to be able to meet the evolving needs of our Malaysian demographic. Yeah, okay, and at a very affordable price.
Thank you. So thank you, every one of you who, came for this discussion.
Thank you so much, Dr. Carol, and thank you so much to our panelists. Let's give them a big round of applause, ladies and gentlemen. It's not very easy to do this. This economy is really, really new to us, and like you said, we would like to lower down the cost and make it a more professionalized economy. Thank you so much. Let's give them one more applause, shall we? All right, ladies, we will be taking a short break before we begin our networking session. It will take about 5 to 10 minutes and we will begin our networking session. So for now, please stay tuned and we'll be right with you. Thank you.